So we are going to be looking at the starting point for exercise, and Lisa will be helping us with this. So we will start from the feet, working our way up. So Lisa has her feet hip width apart, nicely positioned. She also, as you can see, is at nice right angles there, so the knee is above the ankle. The back is fully supported by the chair. Shoulders are relaxed and down, and the head and neck are in a neutral position. So that's the perfect starting point for exercise. So we are now going to look at a shoulder exercise which will aid the posture. And we will be looking at two versions of this movement, starting on this side. So the first version I'd like you to do, Lisa, is to lightly lift your shoulder up, lower, and relaxed. And we'll do two movements on one side. So you're going to lightly lift, lower, and relax. That's one. Once again, lift, lower, and relax. That's two. And then we would repeat the same movement on the other side of the shoulder. The second version of this movement is where you lift up, rotate back gently, lower, and relax. Once again, Lisa will do two of those movements. Lift, lower, and relax. Breathe in naturally. One more. Lift, lower, and relax. And once again, once that's completed, we will go over to the other side of the shoulder. The next exercise we are going to look at is a breathing exercise. I'm going to ask Lisa to relax your right arm down by the side and place the left hand on the tummy. Once in that position, I'm going to ask Lisa to take 2 breaths in, one in through the nose and sigh out through the mouth. So Lisa, in your own time, I'd like you to take that breath in and then sigh out through the mouth. One more. Excellent. So the next exercise we will be looking at is a foot pumping exercise to help to push the blood up, promote the circulation. The starting position for this, I'm going to ask Lisa if you can hip walk yourself a bit further forward on the chair. And the bonus of this position is that you are now having to work on that posture by yourself without back support. And this would be a progression from being at the back of the chair. So now we're looking at the foot pumping exercise. And again, Lisa's in the perfect position. Her posture is very good. Shoulders are relaxed and down. Head and neck is neutral. Now we're going to lift, keeping the balls and the toes on the feet. We're going to lift one, and then we're going to alternate, and then lift the other one. And what you want to do, you want to feel the calves pushing the blood upwards. So you lift and lower. And I'm going to ask Lisa just to make it slightly quicker, just so we can get that pumping mechanism. Excellent, good. Lift and lower. So you could count maybe 50 times while you're lifting and lowering. And a fantastic idea is to count out to yourself while you're lifting. That will ensure that you're breathing and you're also relaxed. So remember, this is a fantastic pumping activity to help push blood around the body. Once that's completed, you can stop and then hip walk yourself to the back of the chair. These foot pumping exercises can be done throughout the day. It can be completed seated, but it also can be completed standing also. So Lisa, if you were to hip walk yourself, front third of the chair, bring your feet behind, hold the chair and keep your head forward, stand nice and tall. Good. And if you make your way around to the chair, we'll have a look at the standing version. Good. So you can hold on, fingertips, just for balance, and it's exactly the same process as the seated version. You're going to lift one heel, keeping the other one down on the floor. That goes down to the floor, and then we repeat and alternate the movement. So standing, no different to seated. Posture is exactly as Lisa was seated, and we're lifting and lowering and pumping and promoting the circulation. And I would advise, if your back is tiring, that you put the chair against the wall to have good support. So we will look at the exercise itself. So Lisa, again, is in the perfect position here. Shoulders are relaxed. And again, I repeat, because this is so important, the thighs are supported. Now, the thing with this exercise is that we need to use the knee as a hinge and lift. So Lisa, if you lift your leg, you're hinging up and you're tensing the upper thigh, and you will count for a count of 5, which I will show you shortly, and then we lower. And we will change legs. So you're going to lift, we're going to go for a count of 1 and 2 and 3 and 4 and 5. Now there is a caveat to this exercise, that we keep the feet moving, so it's going to get a bit technical, but I'm sure Lisa's going to show you how you can do that. We need to lift the heel 5 times the opposite one, and you'll see on the other leg. 1 and 2 and 3, and this is tense, 4 and 5. And then gently lower, lift, hinge, and now you can see 1 and 2 and 3 and 4 and 5, and we're going to do one more. And I'm going to ask Lisa to count out, because this is what we would do. We would like you to do to be sure you're breathing. So
1 and 2 and 3 and 4 and 5.
And relax. Perfect tempo. Nice execution. Final one.
1 and 2 and 3 and 4 and 5.
And relax the leg down. And with this exercise, it can be challenging, pumping the heel and having the extension on the leg at the same time. So we can adapt that slightly by, if you lift the left leg for me, Lisa, you lift and you still count 1 and 2 and 3 and 4 and 5, and then change legs. So this is without the heel lift, which can be difficult, and 1 and 2 and 3 and 4 and 5. So you have an option of the 2. So working this muscle group, which is a big muscle group that we use day to day all the time, especially when we're standing. We are now going to use those big muscle groups by looking at standing. So what I'd like you to do, Lisa, for me, is to hip walk yourself to the front third of the chair. Excellent. Posture still good even with the hip walk. Then bring the feet away so they're roughly hip width apart, and then bring the feet just there, perfect. And Lisa is going to stand nicely using her legs and keeping her head forward, not looking up, not looking down. And if there was a handle on the chair and you need the handle for support, or your thighs, you could do so. But Lisa's going to show us how to do it without. Nice and tall, good stand using the legs, and the posture's tall. And in the reverse movement, if you shuffle back so you can feel the backs of your chair, so you always want to be safe, and ideally this would be against a wall, you'd want to reverse the movement. The head is forward, you bring the bum behind, hold the chair or a handle if you need to, and then sit down in a controlled manner. And then shuffle back. Back is nicely supported. So that's the perfect way to stand, and you reverse that stand to a seated position. This exercise is a low-level march, and the starting point, as with all exercise, is good posture. So Lisa, what I'd like you to do is to start the low-level march, and we're looking at 2 repetitions each leg of a count of 1 and 2. So off you go, Lisa. 1 and 2 and 1 and 2. Great control. 1 and 2 and 1 and 2. Keeping the movement comfortable. The exercise we're going to look at now is a side tap exercise. Starting from a good position, holding the chair for balance. We're going to start with the right leg, and we're going to tap out to the side 2 times each leg. So with the right leg, Lisa, we're going to go 1, With control, 2. Then we pause, then we change. 1. Excellent. Nice and relaxed. Good. The exercise we're going to look at now is a side step exercise. So Lisa, holding the chair for balance, we're going to start with our right leg and do 2 repetitions. Off you go. So 1 and 2 and 1. With control, and 2 and rest. The exercise we're going to look at now is called a tap back exercise. Using the chair for balance, starting with good posture, we're going to start with the right leg and we're going to tap back and then bring the leg, change, go to the opposite side. So when you're ready, Lisa, we start with the right leg. 1, and back and rest. 2. And then we change. 1. Rest. And 2. And rest. The exercise we are going to do are kickbacks. Using the chair for support, we will start on the right leg. We will do 2 on one leg and 2 on the other leg. So when you're ready, Lisa, we'll start with the right leg. We'll go 1. Good. And again, nice and slow and relax. And then we take the time, we change legs, we go up and we go down. And so last one for Lisa. Pause and relax. Individual exercises should be discussed with your cardiac rehabilitation professional. The pace and the number of exercises needs to be individual to you. Start with 2 repetitions of each exercise and build up to 10 repetitions. Keep your pace steady and monitor your breathing. Your cardiac rehabilitation professional may introduce some resistance weights to progress the exercises and make them more challenging.